Hello there, everyone, and welcome to International Bench Central's weekly webinar, weekly workshop, and see you all again. I want to apologize especially for the delay. We've had a bit of technical difficulties that were unexpected, and so I do appreciate those of you who held on and and gave us a chance to figure that out. So thank you so much. I'll actually put a note in there that we just started. Just so everyone know that we're here. And again, sorry for the delay on that. So tonight we're doing a topic that I think a lot of people have asked for, and a lot of people want to know about from whatever we can gather here. We get a lot of questions. Often at the end of workshops, other workshops and interviews, we get a lot of questions about during the mock interviews that we do with people and the interview sessions about how do I answer these ethical questions. I'm really confused about what the process is, what the procedure is. And so I thought it would be a great idea to cover some of that tonight and discuss those. So one thing I want to do is just see if I can get a confirmation that, oh, can you actually hear me well? I'm just going to ask if anyone can hear me. Let's try that. Is that a little better? Let me just check my mic. Oh.
That's why. All right, I think I just adjusted my microphone, so I'm going to assume that it's just better now. So if you are in the chat room and you can hear me better, please let me know so that I don't continue to go on. So I'll wait till I get a kind of a chat response from somebody who's, great. Thank you so much. Thank you to Irma and to Shivli. I appreciate that. And I'm just going to go and check to see. Okay, great. So before we get into this topic, though, again, we're talking about ethics tonight. It's all about ethics. I want to just kind of give you guys a little update on what we're doing this fall. We're helping. It's really busy for everybody right now. You guys and that's definitely taken up a lot of our schedule to work with folks. A lot of you guys signed up for the California special, and that was again, for those of you who did, that's a great. I think it's a great opportunity for those of you to practice with the bench test as well as the interview and interview prep. So you have, obviously there's some schools coming up in terms of interviews right now. If I'm not mistaken, we have Oklahoma pretty soon. We have is it Boston pretty soon. We also have USC and USC, UCSF, UOP, and of course UCLA coming up all the next month or so. So lots going on. There's, I think, even San Antonio. There's a bunch of stuff right now happening in the world of advanced studying programs. And I just want to, again, say to all of you who have interviews, congratulations, and good on you for attracting the interest of these programs. It's not an easy thing to do. We will, down the road, probably talk about, as this sort of bench test and interview season wrap up, we'll probably start focusing a little more of our workshops on the application side of things to help some of those who were at a place where, I did my best, I gave it my all this year, and for some reason they didn't choose me, they didn't invite me for an interview, or I was interviewed and they didn't choose me. What can I do now to reapply, and what are some strategies for that? So we'll probably get down and talk about those in the coming months. But for now, we really still want to focus and help as many people as we can with both their bench test and their interview. And we do that, of course, with these workshops that we offer for free for those who show up. And then also we do that in our courses, the bench test mastery course and also the interview mastery course. And, with these workshops, I want to just say, they're great for everybody. It's like a win-win situation, right? Like I love being able to give to the community. So does Dr. Alyssa. We both enjoy the interaction. We love when people have some great questions, like a lot of you guys do. We appreciate people spending time and dedicating time, taking time out of their busy schedule to come and join us for these. It's, I think the interaction and the attendance and all this stuff makes it so worth it for us. So we want to keep doing that. And then the great thing too is that we take these workshops afterwards and we put them into our members area. And a lot of this becomes content for the interview mastery and for the bench test mastery. These are great teaching tools as well for those of you who say, I missed a lot of these workshops. Well, a lot of them are now in those courses. And so a lot of like for the interview mastery, for instance, quite a number of the ones I've done this summer are now part of the course and their modules, and they're added to what was there before. So I might even have 2 extensive videos for the same topic sometimes. I just want to give as much as I can in there. And so that's just for those of you who are wondering, like, what's going on? Why don't I have access to the old ones? They were free, I thought. And they are absolutely free. We just ask that you join and come to the live ones, and that's the best way to do it. And then for those of you who are part of the membership, just let us know. We'll absolutely give you a link for those. So either that will be a video that you can find in the course or in the members area, or we'll just send you a direct link. So some great ways to see these videos at all times. Again, I'm Kevin Marshall. If you don't know me, nice to meet you. And I've been helping international dentists for a number of years here at International Dentist Central. And I really do focus on the interview side of things. And so we help people from start to finish, and I'll get into that in a little bit. But for the most part, each week we try to come up with a different topic. And this week's topic, again, was the ethical side of interviewing, Ethics 101 or Ethical Questions 101. So without further ado, let's get into this, because I think there's so much to cover. There's so many different scenarios. And what I will say is you may have questions about either what I cover, some of the slides that you see. You may also have questions about stuff I haven't covered. And I would love if people would participate in this workshop. It's always better when everyone works together, and put your questions in the chat box. I will be checking those. And mostly I'll be checking them after we get through a good portion of it. So if I don't see your question and respond to it immediately, I will go back and look at it. Now, I will say this, the more relevant your question is to the topic, the more likely I'll be able to answer it, because of limited time, of course. But if we have some time, I'll try to answer even other questions as well. But again, if you want a better chance of having your question answered, just the more relevant it is, I'll start with those. Basically, those will be the priority base. What else can I say? Interviewing, difficult thing. It's an art. It's a science. It's both. And so ethics definitely makes a big part of that. I think when I started to get into interviewing and I would show up to interviews, whether they were at the university level, which I did a lot of, or whether they were in the corporate world, or whether they were wherever, I found ethical questions to be a little jarring at first, and I wasn't always sure what they wanted from me. What did they want? What were they trying to get after? They might ask me for scenarios. I hoped that I had given like a good scenario or an example of things. And a lot of times I just wasn't sure. Later on, having learned more about interviews, I did realize that I could have done a better job. I could have actually made a significant change to that, and it would have probably been a better route. So it took me a while to kind of learn the ins and outs of ethical questions, how to approach them, and what to do. So I'm here to share that with you guys tonight, and I'm going to switch to some slides right now. So give me a moment. Okay, so hopefully you guys can see this. We're going through ethical questions. Great. All right, so again, Kevin Marshall, happy to be here with you guys. And I won't, I've gone through my journey a number of times. I'll probably skip it for this time and just let you know that we've helped a lot of people over the years with the interview process through coaching and courses and all that good stuff. So one quick thing I want to say, we did a workshop last week about the 4 California schools. Dr. Alyssa and I, we went through each school and we talked about as much as we usually know and kind of the routine stuff. And One thing that came up to us that a few of you guys mentioned was a correction. So I want to add a correction to this for those of you who are going to UCLA and haven't learned otherwise, although I'm sure you probably know better than us for some of you guys. We mentioned that there were a lot more students. I think we mentioned 70 to 80 students that are called for an interview at UCLA. And that used to be true back a few years ago, but just as of last year, it was reduced to around 50, right? And then the other thing that we said, which was again true a few years ago, which is no longer true as of last year, is that we said that not everyone was called for an interview. It was dependent on their bench test performance. And just so the correction now is that from what we know last year, everyone is called for an interview because it's a smaller group that's being called, a smaller batch. Everyone basically goes through that interview despite their bench test performance as of last year. Now, that being said, I want to also say, who knows, right? I mean, only they know at this point how it will work this year. They could invite more than 50 students. They could go back to the 70 to 80. Probably it's around 50 from what I hear, but it could change. And then also, it could go back to how it was a few years ago. It could be where you have to, it's sort of merit-based, and those who pass the bench test have to interview. Are they the ones that get to interview? But the truth is, this is the most recent information we have on the school, and I just wanted to make sure that we put that correction out for those of you who didn't hear from other sources. But thank you to those who brought that to our attention. We get so lost this year, and we're just so busy right now that we didn't have we did a fairly thorough job, I thought, going through and collecting all the information, but somehow we missed this one. So I want to thank you for those of you who made us aware. And it happens sometimes. Let's go to the next slide. And why do these programs ask ethical questions? This is the first thing you should start with when it comes to ethics. Why is the program asking you? What do they care? And if you don't know the reason for this, you won't be able to probably give them what they're looking for, is my thought on this. Here's a picture of an original, I don't know what you would call a papyrus of some sort from ancient Greece. And some of you may be aware there was a philosopher named Hippocrates. And I'm not sure too much of the story. I do know that this oath is named after him. And the idea being that you're, as a doctor, as a healer, if you will, back then, there was a need for ethics even back then. And I was reading some of the original Hippocratic Oath, and I was kind of impressed that a lot of the same issues that that we're dealing with today in our world, they were facing the same things back then. They were, in the Hippocratic Oath, the original one, they talk about assisted suicide. There's a part where they talk about, I promise as a doctor not to give poison to someone even if they're asking for it. There was even questions about abortion. There was questions about not harming the patient, of course. All these things that we kind of take for granted, and we kind of think that they're relatively new concepts for us, or they're new issues for us. A lot of these are thousands of years old. And so it is incredible and to know that for you all as doctors, you're really stepping into this very ancient tradition that's been around for thousands of years, and it's gone up and down. There's been times in human history where we've lost a lot of incredible medical knowledge, and then we've gained it back. If you look at the golden era of the Arabic culture back in I think it was the 13 or 1400s, there was a lot of incredible medical advances going on, and then all of a sudden it was destroyed by the Mongol invaders, and they destroyed a lot of libraries at that time in modern day Baghdad. And we lost a lot of information. And then, some of that, though, still made its way up to Venice through traders and merchants. And that's where a lot of some of that medical knowledge came into Europe at that time. So, we have this ancient stuff that we look to in terms of the actual content that continues to develop and evolve. But in terms of ethics, it's cool to know that this stuff has always been important, no matter what is going on. It's as old as the practice itself. And so, that being said, for those of you who aren't familiar, you haven't read it in a while, I'm sure most of you took the Hippocratic Oath at some point, or some version of it. it might be worth it to go back, and it's fun to look and see what it's all about, because it's really what the whole thing is based on. And that's what these questions are about, is to evaluate your adherence, your commitment, and to see if you really understand what it's about, because it is, again, the foundation. Are you someone who stands up for what's right? You know, that's what they're trying to figure out with these ethical questions and ethical scenarios. And finally, they want to see what your values are. Now, when I say values, everyone seems to have a slightly different values than the other. I don't think there's any two people in the world that have the exact same values. Even at some issue, they're going to have a difference of opinion, right? They're going to have some dispute of what their values. And so there's not a right or wrong necessarily of a set of values, but there are, one could say there's more right and there's more wrong, generally accepted, right? So in terms of a medical practice, like the kind that you all will be entering into at one point, or have already started, you know, in your home countries, then we're trying to, the interviewers are trying to ascertain what are those values and what do you care about as a doctor. So what's your job? Let's think about what it is as an interviewee, your job is for the interviewer. And what I've been saying lately to a lot of candidates that I've been working with is, you know, interviewing is a very complicated art. And one way to think about it is sort of like a poker game, where poker game or a sports game, you can take maybe either one. And in both games, there's rules. And there are assumptions made, and there are people who walk in and know the rules very well. And then there's other players who kind of walk into the game and don't really know the rules very well. And so I'm backing up and giving you kind of an overview of interviewing as a concept. And I want you to know that let's look at poker. For those of you who are familiar with poker, there's an underlying assumption that there will be some bluffing, right? There will be some aspects of the game, and there will also be some times where you are not only, it's not only okay if you bluff, it's usually expected. And if you don't bluff, it's expected that you probably will lose more than win in poker, right? It's a very interesting game in that sense. It's not completely unlike interviewing. There is also an aspect to interviewing that's similar, where it's not to say that you're not to the same extent where you're complete out. Sometimes you're lying just right out in poker. This is not the case. In interviewing, you really do want to focus as much as you can on telling the truth and being honest. But there's also an assumption from the interviewer point of view that most candidates are probably going to stretch the truth a little bit. And if you, as an interviewee, don't realize that that's what they're assuming, that's where I find that some candidates will expose too much information and let themselves get, I call it, they shoot themselves in their foot, right? They expose so much information that they weren't necessarily required to do, and it ends up hurting their candidacy or hurting the interview. So while I don't condone lying, I do take the approach that not everything in your experience needs to be fully revealed during an interview. I mean, this is not a court case. You're not being questioned by the police. This is not, this is not a, there's an aspect where there's a game to it, and this is an interview. And there's a joke I always like, something to the effect of, if everyone was as good as their resume suggested or their CV suggested, everyone would be incredible, right? If only I was as amazing as I am in my resume. So that's a joke, and the reason it's funny is because there's a commonality to it. Most people are bringing a certain sense of expanding the truth or something like that, and it's just the reality. I don't think it's right or wrong. A lot of times, it's just how the game is played. And I'm just kind of making you aware of that. Now, how does that relate to ethics? Well, in ethics, it's one of those things where you have to be very careful about that. You don't. While there's other questions where you can usually kind of stretch the truth a little bit, you really need to be mindful of that kind of stuff. And my best recommendation is to try to find as many honest scenarios as possible when it comes to ethics. And people can really sniff stuff out when you make stuff completely up. So we'll get into a little bit more. Now, your job, again, is to really convince them under no uncertain circumstances or scenarios that your full intention is to live up to the highest ethical and moral principles, both as a student, a professional, and a doctor. You also need to be able to convince and give them specific examples of ethical scenarios you've encountered. So you need to be able to do both. There's going to be questions for ethics that are going to be a hypothetical scenario that they give you, and you have to tell them what you would do. And then there's other ethical questions where they're going to ask you to give them real life examples of things that you've encountered. You need to be able to answer both, and you might get both in the same interview. So let's go for the nuts and bolts tip number 1. We always like to have these in our interviews, and I'm just going to check that everyone is able to hear me. Looks like they have. Okay, great. Nuts and bolts tip number 1. There is a right answer to most ethical questions. I'll say most, but in general, there's a right answer to ethical questions. Few other questions on your interview will be as black or white in the way you respond as ethical questions. And now that, I will say still, well, there is an exception to that. That's true for some of the more basic standard ethical questions, and especially if they're like a scenario where they give you a hypothetical. There are, of course, ones that get a little more gray, but in many cases, there's a right or wrong to them. And so we'll go over what some of those are. It's often good to avoid maybes and I don't know and I'm not sure with a lot of those types of questions. It's better to be decisive and strong about your principles and about what's right. I tend to think that is a better approach than being kind of like, well, I'm not sure, maybe I would turn that person in, or maybe I wouldn't, I don't know. To be a little stronger and say, I would, and here's why. That usually comes across a little better with this, because again, this is testing your values. They're not testing your maybe values, they're testing your actual values. So think of this as sort of a rule of thumb, and know that as the ethical scenarios get more complex, this becomes actually less easy to adhere to. So you might be given a really complex and difficult ethical scenario. You got to do your best to still try to be very sure and to choose and be decisive in the way you talk about it, even though it'll be more difficult to do. The nuts and bolts tip number 2 is to have multiple ethical scenarios available at your mental fingertips, and able to discuss on cue. So what does that mean? It means having a dental scenario available at your fingertips, and I say mental fingertips because you can think of it that way. Like I talk a lot in the Interview Mastery about bringing to the interview a bag of stories, it's a nice way of giving you some imagery about that. If you can imagine a bag around your back, or maybe a backpack, and you put a bunch of stories in there. Ethical scenarios, ethical stories that you've encountered in your life should include dental ones related to your dental career. And that should be both on the job, like treating a patient type of ethical scenario. It could be and should be, there should be one maybe related to dental school, one, so dental school, I would say, and then again, maybe just the clinical practice side of things. Maybe one related to classmates, maybe one related to colleagues, maybe one related to supervisors or bosses. These are all some of the different ways we can do it, all related to dental. Education, if it's not something that you've experienced in dental school or in a specialty program, another option would be just general education, either in high school before you went in there, if it was a big enough scenario. Or some people go to masters, and some of you have masters in public health, or other programs that you've done that are not necessarily dental or dentistry specific. Maybe they're medical, maybe there's something else, maybe they're business even. So it could be there too, and ethical situations come up for all this stuff. And then finally, a personal one, I would bring a personal one to, maybe it was related to a friend, maybe it was related to a family member, something like that. Personal one is less common. So just to kind of give you an idea, they're probably going to be expecting mostly dental career, clinical, academic, and yeah, mostly clinical and academic, I'd say. And then maybe second tier would be, again, the educational side outside of dentistry, and third would be personal ones. I don't think it's, from what I remember, it's very common to ask or expect a personal ethical dilemma, though it could happen. Now, here's one of the more important things I want to discuss, which is that this is where I think most people make the mistakes that I see when giving ethical scenarios. So maybe the question in your interview is, give us an ethical scenario that you've encountered, right? And this is probably one of the most popular ethical questions out there. It's your job to give them this thing. And we talked about, the ones just in the last slide, the different types you can give. But what a lot of people do is they don't really understand what an ethical situation is. And so this picture to me helps represent it's one of the better representations of what an ethical scenario is. In an ethical scenario, you're pulled in two different directions at the same time. You don't know always what to do. So you have here, this is the old one. What would you do if you had a speeding train and you're the one who controls the lever, right? And if you leave it the way it is, it's going to kill 10 people, or 5 people in this case, run over 5 people. But if you move the lever, you're going to kill just 1 person. So do you see the tension here? I mean, many of you have already seen this one, but if you haven't, do you see and do you experience the tension? There's a tension because both kind of suck, right? Both lever maneuvers don't lead to a good thing. They both lead to bad situations. But one could argue from a philosophical point of view that one pushing the lever one way leads to a less harmful situation than the other. That's what each ethical scenario you think about should have. There should be sort of a possibly bad or a consequential result with either decision that you make. And you're talking about, there was a time when, and then you're talking about the circumstances and what was that like? Who were the people involved? If I did this, person A got hurt. And if I did that, person B got hurt. Usually that's the way it's going to go. And the question is, it's usually like this picture that most of the time you choose the lesser of the two evil consequences. So it could be as simple as, do I hurt the patient and ruin my friendship with Bob, or do I go with Bob and take his side and keep my friend with Bob and hurt the patient, right? So, that's a very simplified version, but basically in that situation, there's a tension, right? Bob is the one on top. Bob's the person you're going to hurt, but the patient is a more disastrous outcome. You're going to hurt by going with Bob, by siding with Bob, your friend. He's going to like you. He's going to be cool with you or whatever, and the patient suffers. And in medicine, that is the bigger issue. That's the wrong, if you will, answer. So even though, but it's important to note, and I think this has to be emphasized, that there is a negative consequence to siding with the patient and protecting the patient, and that is losing Bob's friendship. So even though you might think, well, Bob, what is the big deal about losing a friendship? Obviously it's much better to lose your friendship than to and go with the patient's side than the opposite, right? Well, that's true, but in reality, you'd be surprised how many people side with Bob instead of the patient because they feel bad, they don't want to be embarrassed, they don't want Bob not to like them. There's all these human emotions that make us very very corrupt as a species. Sometimes we're very corrupt human beings, right? And there's a fallacy to human beings and human behavior that we can clearly see, and you can see it even in the news all the time, just even recently. So clearly, in a perfect world, we would always make the best and most logical decision like a robot, but that's not the case. And humans make bad decisions all the time when it comes to this. Now let's talk quickly about the 4 pillars of medical ethics, which I think is important to go over. A lot of you probably have seen this in your studies, and maybe you saw it at the very beginning of your of dental school, so maybe it's been a while for some of you. But it's important to think about these two. And again, these are relatively related to the Hippocratic Oath. A lot of them were later on developed by medical philosophers in maybe the 19th and 20th century. And they were sort of reinterpretations of the Hippocratic Oath from Greece and other sources over the years, as a way to kind of define, well, what does this mean? What is this oath really about? What is this do no harm thing about? Let's break this down and kind of try to understand it better. So we have 4 elements of the medical ethics, and so it's good to think about these in terms of various kinds of cases that you might encounter as a dentist, and scenarios that you might receive in your dental interview. So you want to think about each situation in terms of the first one, of course, being autonomy, right? And so we all know, medicine is very important to follow and adhere to autonomy for the patient. One of the biggest things is that a patient has the right to refuse or choose their treatment, and for the most part, this is always the case. Now, there's obviously exceptions to this where you might have a child involved who doesn't have the basically this is where parents have to sort of take that role on, and sometimes a child may not themselves have a good sense of what's right or wrong for them. And they may, they say, I don't want to go to the dentist. And you're like, well, if you don't, it's going to get worse. They don't always know the consequences. They're not experienced enough. So autonomy does usually cover things, but of course there's always exceptions. And but when you're thinking about some of these ethical questions, I want you to be thinking about, okay, is there autonomy? Is that being satisfied as a dentist in my discussion with a patient, or giving them options? Am I giving them the options that they need? Non-maleficence, maleficence, I always get that word. But anyway, in terms of non-maleficence, basically it's to not cause harm. It's that old promoting more good than harm. And the other way it's often put is first do no harm, which there's a Latin origin with this primum non nocere. And that's a lot of where when people talk about the Hippocratic Oath, you hear that phrase, do no harm, first do no harm. And that's where that comes from. It's basically, I as a doctor will not be the cause of harm. I will be here, my actions will promote the good of the patient versus harm. And that, of course, as you know, doesn't always mean intervention. It doesn't always mean medical intervention. A lot of times it means being conservative about things and seeing how things go, and letting the body kind of take its course to a certain extent. So there's that aspect. Justice, this is actually a larger viewpoint. And so when we talk about justice, we're talking about how it concerns the rest of the population. And so you might have a situation where you have a hospital, and there's like recently there was this terrible tragedy in Las Vegas. You could look at that. You can look at the tragedies in Houston, and you can see that there's only so many limited medical professionals at these hospitals. Who do we treat? People are coming in. One person has a gunshot wound, and the other person just has a broken leg. That's the whole thing about justice, making sure that we're being fair, and we are treating each person based on the priority and what's best for everyone a lot of times. So it's like kind of that, going back to that example of this railroad, justice would kind of be saving the 5 people, sadly sacrificing the one. And so that's the difficult thing. That's a difficult choice to make. And that's why ethics are so complicated sometimes. And then another fun word, beneficence. So maleficence and beneficence. So these are clearly like Latin words that we don't say very much. And this should be kind of similar to the other ones. The practitioner should act in the best interest of the patient. But that, like I say, that may mean non-action as much as it means action. And so it's really up to the doctor to really evaluate what is going to lead to the best outcome. So these are just things that I like to throw in there that may help you think about ethics in a more clear way. If you're not I just don't know what to do on this particular one. So we have about almost 18 minutes left, and I want to go through some examples. Let's get into some. I'm going to go through some scenario examples, and then I'm going to talk quickly. We usually take a few minutes to talk about what we're offering in terms of interview mastery, and then we'll finish with some more scenarios that I think will be interesting. So, and we'll also talk about some questions at the end. So let's get into some right now. Get into some scenarios. This is something. So again, I mentioned that ethical questions usually fall into two categories in an interview. They're either going to be giving you a hypothetical question, or they're going to be asking you to give them an actual real life example of something you experienced. So the first ones we'll go over are hypothetical scenarios that they're going to give you, and you have to decide what you would do if you were in this position. Now you're a dentist. You perform a root canal on a patient at the student dental clinic to meet your final requirement in order to graduate. Maybe here at the dental clinic at this advanced dining program. During the treatment, the file you're using separates, and what's left is a remaining piece inside the canal. Now, of course, some of you have been in this situation, maybe many of you, I'm sure. Not a fun situation. You're kind of, oh, shoot, great, this is not what I need. If your supervisor, in this case, let's just say that if your supervising professor were to learn about this mistakes, of course, he or she would not be able to mark you off as a success or a completion for this particular requirement, because you need so many to graduate. And so what could happen is that you might have to enroll for an additional semester just to get this requirement met. So there's a lot at stake here. And so again, we're going back. Again, I'm going to bring back this picture. There's tension here. On one side, I'm the person at the top. Let's say in this case, I suffer, or the patient suffers. And so which is the best thing to do? Who's who? I guess I shouldn't say I'm the one at the top. We have to decide who's at the top and who's at the bottom. Which is the worst of the two evils? Is it better for me to do the easy thing and say, you know what, if I don't say anything to the patient and I just cover this up, nobody gets hurt. I don't have to worry about this. I'll just zip this up, fill this up, put a cap on there, put a crown on, and no one will ever know it. It's my little secret with myself. I get my requirement met, and the patient thinks he got a great treatment done. Probably won't ever affect him, and everybody's happy. What would you do, right? So, there's obviously a lot to think about, but the truth is, what's the right answer? We all kind of know the right answer. The right answer is to do the hard thing and to say to the patient, listen, I have to be honest with you. You have this piece, the file broke. It happens. It's a fairly common thing to happen. It's not a huge deal. And here's what it's going to look like for you. We're gonna complete the treatment. We're gonna follow up with you in 6 months or a year, and most likely you'll never have to worry about this again. But there's a possibility that it could cause problems down the road. So I need you to know that. And so that's the right thing to do. It's also the hard thing to do. That may mean, but that likely means that you're not going to meet your requirement. Now you might be thinking, okay, well, how about this? How about I just tell the patient what's going to happen, but I don't document it exactly like that. I just say it was fine on the paper, and then I don't tell the professor. I still get my requirement, but I did the right thing. I got to tell the patient the situation. That's good, right? No, that could obviously lead to problems, right? So what you have to do in this question, of course, is think about it from the point of view of you as here you are, this dentist, and you're in this situation. Now you're answering this question as an interviewee, and really want to work through these different things with them. And again, this is where that black and white thing comes in. Like, there's a right answer for them. Now, I don't know what every dentist out there does. I'm sure this situation has happened before where they just cover it up, don't say a thing, and they're out there practicing. And I'm actually, I'm going to try not to judge right now, try to not put on my judgment hat about that. I do tend to think this is a situation where if I were a patient, I'd want to know. And so I think the right thing to do is to tell the patient absolutely. But what matters also is that you are very clear about this in your interview, and you're not sitting there wavering too much. Well, maybe I could just get away with it. It's very clear for you. The best thing to do is to tell the truth. Now, here's the problem with ethical scenarios that are hypothetical is that sometimes they're a little too easy on you, because it's easy to sometimes say, well, I would do this. The actual truth is it's always harder to do it in reality. So I don't always think that they make for the best evaluations of whether someone has values or not, because it's easy to know. But sometimes people get caught and they actually still will say the wrong thing, even on one that's relatively simple like this. Here's another one you're given maybe by your interviewer. You have a young girl of about 15 who's coming into the clinic with her father. The father doesn't want the daughter to have her teeth taken out for whatever reason. And yet the daughter is in pain and is trying to tell you that he would like to have the tooth, he would not like, I'm sorry about this typo. The daughter's in pain, but he's trying to say, I don't want my daughter to have the tooth removed. And the father doesn't speak English very well, and neither does the daughter. So and they don't speak a language that you're familiar with. So here you are in this situation, daughter's in pain, daughter doesn't really know, maybe the daughter is even saying, maybe I do want the tooth taken out, but the father is against it. And ultimately, who has the authority? Well, this is where it gets down to sort of autonomy, questions of autonomy. It's much more complicated, right, than the last case. And this is one where you're really going to have to work through in the interview with them the different pros and cons of each side. Well, on one hand, you have this aspect of autonomy, and a 15-year-old is still not at the age where she has full autonomy or full authority to make the decision that's best for her. So that's one situation. Excuse me. And then on the other hand, you have the plain and hold, you have the issue, and we talked about the pillars of ethics before. Let's see if I can go back. You have non-maleficence and you have beneficence. And these are two that are playing into the aspect of not only do no harm, but do good. Sitting here and seeing a patient like this daughter in immense pain, and it's a fairly simple procedure that would remove her of that pain. That's not just letting her sit and suffer is definitely not doing no harm, and nor is it doing what's best for the patient. So these two are kind of, you can see the different pillars are kind of working against each other here. You have the non-maleficence and the beneficence butting up against the autonomy and who has the authority to make that decision. And so the father should technically have the authority to say yay or nay on this, but you're able to sense that either something's going on, he doesn't have an idea, maybe he doesn't know. And so one easy place to start is the language barrier. So we make the assumption, you know what? Maybe this is just a mistake on his part. Maybe the reason that he's so against this is that he doesn't understand what needs to be done here, and he's scared, or doesn't trust dentists because of past bad experiences, or he doesn't, for whatever reason. So an easy fix would be, if I were in the situation, would be first I would see if I could find a translator. I might call someone I knew. I might hope that one of my dental assistants speaks the language. If so, I would use him or her as a translator. If not, I would try to find a translator in some ways, and maybe I get my dental assistant on the phone and try to find somebody who can speak their language so that we can have a conversation. Excuse me. And after that, if we had a clear translation and the father still didn't want to have the tooth removed, now it gets a little more complicated. And at this point, you need to be probably determining from the father, is there another parent? Is there anyone else that we can talk to, that we can reach out to see if there's a consensus? Because I really don't feel comfortable letting you go home or letting her go home in this kind of pain. Can I offer to refer you to another doctor? And then if you did that and they said yes, maybe he doesn't trust you. So you're trying to figure out what the problem is. Maybe he just doesn't trust me as a doctor. Okay, great. Is there a doctor that you do trust? Is there another doctor that I could refer you to? Can I refer you to the hospital? Trying to really become a problem solver in this situation. And ultimately, you're hoping to get to a place where he's willing to take some action. If nothing happens, right, and he's like, no, there's no way you're doing it, then I would think about, ultimately, I might, if they were like, I'm leaving the office and she's in pain and we have no intention of taking this tooth out, I might follow up later with them that evening to see what happened. Are they still sure about that? If so, they're still not going to take the tooth out, then I might bring in the authorities at that point, to be honest, and maybe child services, because that becomes a situation where if you know there's a child suffering unnecessarily and the father's unwilling to do something about it, that unfortunately might be a situation where you call in the local government and say, there's some neglect happening here, at least in my opinion, my professional opinion. And that would be the right thing to do, right? It's interfering with their family life, yes, but in a way that could be positive. And again, it's matching up to that beneficence. It's really doing as much as you can for the patient, for the best outcome of that patient. All right, so let's quickly, again, we're going to talk about questions that you guys have in a minute, and we're also going to talk about a few more scenarios I think you'll want to see that are on the opposite side. These are scenarios that you're going to have to come up with. So we're going to go through some sample ones that you're going to maybe have to come up with during your interview. But let's talk quickly about the interview mastery. I do the interview mastery. I've done all of the coursework for this. There's about 15 hours full of video and different courses, quizzes, exercises, all these different things. There's about 6 or 7 chapters of the interview mastery. And this is where you really learn about how interviews work, strategies to respond to commonly asked questions, how to handle difficult interview personalities. This is a big one. I always talk to a number of candidates every month who have had like horror stories of really bad interviews that went, so it should have been good interviews that went bad. They either got into arguments with their interviewer, or they started to get defensive, or the interviewer just had it out for them. And so we talk about how to deal with that, and also how to differentiate yourself from other candidates. It's always finding a balance, and it's not about standing out in just a crazy way all the time. It's there's a certain balance, and I've come to kind of find balance in this myself. Like I want to ensure that we're trying to find ways to differentiate yourself from other candidates when appropriate. Like a lot of times candidates are often the same in terms of the eyes of the interviewers and the application and the selection committees. They just see, oh, okay, well, all these stats look the same to me. You went to a similar dental school for a similar amount of time with a similar GPA and a similar TOEFL, and all this stuff is so similar, similar experience. So that's one aspect, the application. And then when they talk to each candidate, it happens again. There's similar responses for everything. One of the most common phrases in interviewing for dental school, and I'm sure many other types of interviews, is hardworking. How do you describe yourself? I'm hardworking. I would say, if I could, you've seen some of these little diagrams or little visuals that show the number of times a word is used, and there's like the more times a word is used, the bigger it gets. If I could do that with dental school interviews, hardworking would be massive. Take up all the room. People use that constantly, and so we really work to try to help you think of other ways of talking about the same things. And persistence, those are very common phrases, and we help strategize with you to do that. So there's a lot of great coursework. It really gives you the foundation. Then for many of you who are interested, we have something called the pre-mock strategy session, and that's really to help you work on those really difficult questions that a lot of people get stuck on. We've added this recently to the course, and we feel like it's working very effectively to help people know what to say, not only just for their interview, but for their mock interview, which is getting. If you can do well on your mock interview, then you're going to do even better on your actual interview. So we have the 2-hour mock interview session with feedback. This is a full practice interview covering all the commonly asked questions. And that's usually conducted with me or one of our interview specialists. It's tailored to the school you're interviewing at. We go through and we coach you on these things and work on your weak points and give you a lot of feedback about this. And we spend a lot of energy and time with you to really make sure that you're prepared. That's my main goal. And for those of you who are interested, you can sign up for another one if you want. There's another there's a 2-hour panel one that's with me and another person to give you more of a panel-like experience. So again, interview fundamentals, confidence, U.S. culture, that's an important one. Even getting into issues of family. How do you talk about your family? How do you talk about your children? Differentiating yourself. How do you respond to specific questions? These are some of the things that we cover in this session or in this course. If you're going to sign up for the Interview Mastery and you're thinking about it in the next, you have an interview in a few weeks or a few months, probably in a month or so, do it earlier than later. Don't wait to the last minute. If you wait to the last minute, we cannot guarantee that we'll be able to accommodate your schedule, just because it's very, very, it's hard right now. Everybody's trying to interview. And so we really would say that give us some time and let us know ahead of time. If you do sign up soon, schedule your mock interview and your pre-mock session immediately after you sign up so that you can lock in those dates. So I'm just throwing that out there. And let's get to the example ethical scenario number 1. So this is one where they're saying to you this. They're saying, all right, give us an example of an ethical situation that you faced or an ethical scenario that you faced in your past. So here, what do you say to that? So we'll go through some different scenarios. One that is that could be real is that perhaps one would be, I worked at a clinic in my home country where a supervising doctor or my supervising doctor or my boss, somebody, encouraged or even demanded that I overtreat my patients. And so this would be a decent example. With all these examples, though, what I really want you to think about is, did this happen to me, or did something similar to it happen to me? Because if it's either of those, then that is the one I would probably run with. If you've never had anything like this before, okay, yes, technically you could make up a story, but it's hard when you make up a story. And again, I'm not a big proponent of making up stories because, I don't know, about at least with ethical situations, probably 8 or 9 times out of 10, it's fairly easy to see whether someone's telling the truth or not. You know why? Because a lot of times the story is pretty vague and it doesn't sound believable. So it has to kind of, again, meet 2 criteria. Stories should be specific and they should be believable. So, and we'll get into the believable part, but let's say this is the situation you're going with. I worked at a clinic in my home country. My supervising doctor encouraged and demanded me to overtreat patients. So again, you maybe patient comes in for a small carry. You notice they have a carry, and you think to yourself, okay, this is a simple drill and fill. I can do this, no big deal. But as you're either submitting your treatment plan to your supervisor or mentor, or they happen to be coming by and they're like, what's going on? And you say, oh yeah, this is a simple restoration. Oh, well, you're going to do that? And they, maybe they look at the report and they're like, I think actually maybe this calls for a root canal. I just think that's the better, more conservative way to go. I think that'd be the safer way for the patient. And you're like, really? This is the situation. Now you're in this ethical dilemma. What do you do now? Now, one way, of course, is to say, well, I would say no. But one possibility that the interviewer could say to you is, yeah, but what if you were to lose your job? And, or what, okay, now we're talking hypothetical again. But if I'm answering this as if it happened, I should say, I have to think about the fact that maybe I would have lost my job. To say no to my boss, my supervisor, I could have really gotten him angry, or I could have made enemies with him, and maybe he could have made my life hard at this office. He could have lowered my pay, or he could have lowered my pay by restricting the number of patients that came to me. Maybe he or she might have the valve to open up patients or not to me. So there's a lot of things he might be able to do, and so you have to think about that. A lot of people will just say, yeah, I told the boss no, I'm not going to do that. That's where I would suspect that this is a fake story, actually, to be honest, because I would say, really, you're that confident that you could just say to your boss, nah, I'm not going to do that. I'm going to do it my own way. That, to me, is, again, that yellow flag that when I hear it, I say, yeah, that might be a fake story. And I'm going to, if I suspect it's a fake story, I'm going to go after you as an interviewer. That's my job, is to really try to squeeze it out of you. Is this a real story or not? And I'm going to punch you for not literal punches, but metaphorically, I'll punch holes in your story to see if there's anything that's amiss. So you're leaving your story open for holes to be punched in it, basically. And I'm going to go try to find everything I can to see, okay, give me specifics. Give me, where was this? When was this? What was the name of the patient? What was the doctor? So I'm really going to go after you in that sense. And you have to either be a really good liar who lies on your feet, or this has to be a true story, right? And so to me, again, I would rather be in the situation as an interviewee where this was at least based on a pretty real story, so that when they start to go after me and try to punch holes in my story, I'm prepared and I have actual memories of the situation. I can talk about these things. Like I say, it's no fun when you're kind of outed and they realize, oh, okay, this person's not telling the truth, because that just sours the interview at that point. So think about this. This is, again, one possibility. Like I say, this may or may not be something that happened to you. And if it's not, think about other ones that did happen to you. I'm just giving you ideas. Another one, classmate asks you to complete a lab requirement on a typodont, something like that, to get a pass. So they want to help, do their requirements. This is one that every so often someone will discuss with me. And it's a pretty good one, I'd say. I mean, but again, this has to be real for you. It can't just be, it's easy to think that you can just make these things up, but I really encourage you not to. I really encourage you to really tap into your own experience to see what was the real story, what was a real ethical situation. I'm just trying to bring these up as a way to kind of have you brush up on them and think about them. Again, the classmate asks you to complete this lab. Hey, can you do this for me? Or can you, and you have to make a decision. What do you do in that situation? Do you just give them a pass? Do you help them out or not? And so there's the pros and cons. And so you're going to want to talk about what was going on in your head. Now you might think, well, what's the problem? I'll just say no. Well, that's not always so easy, especially if that classmate is a friend or an acquaintance, so it's not always easy to say no. Ethical scenario number 3, over lunch, a fellow colleague tells you that she sometimes withholds the fact that she could do a bridge, but instead she informs patients only about the option of an implant, and in order so that she can ultimately bill the patient more money. So kind of similar to the first one, but this is more, instead of the supervisor pressuring you, this is one in which you now have been told something that is making you uncomfortable. So here you have the situation, you're friends with this colleague, relatively, maybe you're an acquaintance, and she's kind of like, hey, I got this thing I'm gonna tell you. Maybe she thinks she's helping you out or something. Like, hey, you wanna make more money? All you got to do is just stop. Don't tell them about the bridge option. Now, you might say, well, that's not so bad, because, we all know that implants they have a better likelihood of success long-term and longevity. So what's the problem with that? Everybody wins. The patient wins, and we make more money. It's a win-win situation, right? Yeah, maybe not. And so in that case, you'd have to think about, like, this is that part about don't do any harm. The patient needs to be, and autonomy, the patient needs to be informed about all their options. They can't just tell them, oh, this is the only way to go. You have to tell the patient, well, there's bridge or there's an implant rule. So if I were giving this scenario and this happened to me, then I would talk about, this fellow colleague told me this, and what did I do in that situation? Now, ultimately, the bad thing to do would be to do nothing, right? So you would just say, well, I mean, again, in the context of the interview, and that's important to say, there are many dentists who understandably could hear this from a colleague and think to themselves, well, that's not cool. I don't agree with that. I don't agree with that activity or that action, but I'm not going to interfere. Ultimately it's not harming the patient that much, and maybe there's a case for just saying, well, I don't agree with you, or you just say, I don't agree with you. But the other option is to, when you're talking about the interview, this is where it gets a little tricky. You need to show that you're someone who does adhere to the right rules, to the right answer of things, to the right way of doing things. And so to say, I'm not going to do anything about it, I'm just going to sit there and listen and judge her, that's not enough, unfortunately, in an interview. In an interview, you want to show that you're the type of person who takes this stuff seriously and says, you know what? You either have to say to that person, you know what? what you're doing is wrong. You need to inform the patient about the possibility of doing a bridge. And if I ever hear that you're continuing to do what you're doing, I will report you. Or you ultimately do report them and you talk to your supervisor and just say, you know, I think that this is a problem. And you, you know, hopefully your supervisor also agrees with you. And if they don't, then I guess, you know, another possibility would have been to go to the authorities on this. But my sense is going to the authorities on this, and if I'm telling the story as if it happened, if I say that I went to the authorities, that's where it starts to get into the believability aspect. Is it believable that I went to the authorities about this? It's not the biggest deal in the world, but it's also not the smallest. So to me, the most believable reaction to this would have been to say, well, I don't agree with that, and I think you need to stop that behavior. And if I hear that you're doing that any further, and if you're not giving them options, if I hear about that again, or if you inform me about it, I will tell the authorities. I will report you. So that to me is a more realistic approach, because again, this is a story I'm actually recounting. It's not one that is a hypothetical. So I want it to sound believable. I don't want to be like, yeah, I'm making this up. And I went to the authorities and they closed down the clinic. I mean, that doesn't sound as believable ultimately. So it's a hard one in that sense, but it's possible this could have happened to you. Again, if this didn't happen to you, then you know, I would skip this one. Another one is maybe you were working at a large dental clinic and the office manager, who was a non-dentist, informed you that the way things are done here is to always let patients know that they need a bone graft, even after simple extractions. And what did you do in this situation? And they said, you know, just tell the patient it's in order to fill in the socket, because a bone graft, again, will make we can bill more. What did you do in this situation? This is another situation where you're like, you know what, I appreciate that, but I don't agree with that. You know, I told the manager, I don't agree with that. I don't think that you always need to fill in the socket. There are some cases where that would be appropriate, but you know, in the case of the simple extraction that you're talking about, that wasn't the case, and I'm not going to do that any further. And they might say, well, you know, I'm going to report you to the supervisor, or they might actually more likely have said to you, okay, well, you decide what you want. You're the dentist, but then you paid it. What was the consequence you paid for that? And so that would be where you say, you know, they tried to, you know, make my life a little harder there. They either withheld assigning me dental assistants, or they withheld patients from coming my way. And I was based on I was given a commission. I was on a commission basis, not a regular salary. So it really did start to affect my paycheck. And I had to talk to the supervisor, or I had to talk to the regional manager about this and make it a big deal. And so there's ways that you can talk about that story too. So again, these are different thoughts and different scenarios that I've encountered. These are things that I've heard about people bringing into their interview. If these situations are not yours, don't worry about them. You don't have to latch onto them, especially if they're relatively complicated ones. I don't want to encourage people to try to make up some story that's relatively complex or very strange and leads to you just kind of sounding like it's not a real story, right? So those are some stories. I'm going to quickly, though, throw in a few things of stories that I don't like, because I didn't make a slide for this, but I actually just want to throw that in there. The questions or ethical scenarios that I don't like to hear when people bring them up are ones where a patient asked you to, patient may have asked you to do something like, oh, can you please extract a tooth that I want it to be extracted, but then when you looked at the tooth to diagnose it, you found nothing wrong with it. This is somewhat ethical, and so there's a possibility this could work for you. The problem, of course, with it is that it's there's less of a, in this case with a patient, there's less of a tension between consequences. Like the consequence of saying no to that patient, no, I'm not going to extract your tooth because there's nothing wrong with it. That's not a very big consequence you have to pay. The worst that's going to happen is that patient gets mad and walks out the door, and you lose, you know, $50 or whatever, or you lose $100. The consequence of taking the action and extracting a tooth that doesn't need to be extracted is much higher. So to me, it's like a no-brainer. It's not really testing your ethics at a very deep level Yeah, you could make it work. You could argue for it, but I'm just kind of throwing that out there that sometimes questions of like patients asking for things or they want free dental, another one would be like, oh, a patient came to me and wanted free dental work. Okay, that's nice, but you could just say no to them. That's more of a policy. We don't give free dental work. There's not really much of a tension going on there. There's not like, oh, I don't know, I want this patient to like me. I mean, you're not going to really think that, right? You're just going to be like, no, we don't do that. And so it's not really creating in you this tension between, well, there's bad scenario A and bad and worse scenario B. It's just simple, no, I don't do that. And you're not really paying a consequence very much. And then finally, another one would be the patient it didn't have any money and you basically paid for the patient. This is probably the worst one because there's really no ethical situation here. If you paid for a patient's dental care, then that means that the dental school or the clinic you were working at didn't lose any money, right? No one lost money except you. And it's your decision to if you want to throw your money in a trash can and light it on fire, you have every right to do so. So it may be stupid, but it's not ethically immoral. There's no one stopping you from doing that, right? So if you want to throw your money at a patient personally because you feel bad for them, what's ethically incorrect about that? Nothing. I really can't see anything incorrect. There would be something ethically wrong if you said, I'm not going to charge you, but you're using up resources and time for your clinic or your dental school. And so the dental school, you're keeping that information from your dental school, or you're keeping the information from the dental clinic that you work at. So you're basically hiding the fact that you did this treatment on a patient. That would be ethically wrong. But guess what? You would never say that ethical scenario in a question like this, because guess who would be the one who looks bad? You would. So why would you say, well, I actually stole from my dental clinic? That's the ethical scenario. That would just throw you completely out of the interview. So of course, that's probably not likely to happen. So a lot of people just hope that they can get away with saying, oh, I gave some free dental care away to a patient, and hope that that covers it. And again, there's really not a big price to pay for doing so to anybody else. It's not hurting the patient. It's not hurting the clinic or the dental school. It's only hurting you. And while that's bad, it's your decision. So there's no one really in a strange position except for you in that case. And that's the situation. So think about those. Those are just, again, a few bad examples that I often run across that I'm just like, no, that's a weak one. I just don't buy it. And I don't think they will either. If they get one like that, if they're a more intense interviewer, they'll push on you for another example. So think about that. So again, let's talk about some questions. And I think we'll have some good questions. My hope is. Feel free to add those right now. So if you have a couple questions, I'd love to hear them. And we are kind of running out of time, so we'll do our best to go through these. What would you do if you found one of your colleagues chatting during the exam? That would be a question, right, that you receive from an interviewer. And, I think the first way I would respond to that is just to say, first I would tell the colleague, like, I can't talk right now. And if you continue to talk to me, I'm going to tell the professor. If he continued or she continued to ask questions to you and talk to you, and if that happened to me, I would either raise my hand. I would probably raise my hand or get the attention of the supervisor or professor and just say, hey, so-and-so is bothering me. So-and-so is interfering with this, and I would have them be notified. I'd have the professor notified about it. So pretty straightforward one. You might get something like that, and I think that's the way to go. At this point, there's nothing that they've done that's cheating. For all you know, they're just talking, and that's rude. But they could have also been trying to cheat, and if that's the case, then you would definitely want to turn them in. Another good question by, I'll just say RMA. What would you do if you saw a dentist, or if you saw below standard dental work by another dentist on a patient who has come to your treatment? So this is a really interesting question because we don't know a couple things about this. We don't know whether that treatment by the other by the other doctor was intentionally bad or just out of negligence. Probably more likely to be negligence, right? So negligence, or was it that they just are a terrible practitioner? So there's this is where, again, so the ethical questions can go into gray areas. And so we, in the many ways, one aspect of being ethical to the community of dentists is to not trash talk other dentists, to be, for lack of a better term. Don't talk bad about other dentists. That's also not ethical, right? So to tell the patient like, oh, this is terrible dental work, you're now kind of breaking an ethical rule because it's not an ethical rule that we talked about in sort of the 4 pillars for the patient. It's sort of one that sort of come in on the side within the community of medicine, that we don't badmouth each other. And I'm not sure whether that ethical rule is ethical purely, if it's a purely ethical rule that helps the patients, or if it helps the doctors more. My sense is that it actually helps the doctors more, right? I mean, that's kind of what it's doing. So it's basically stopping people from whistleblowing or saying, hey, this is bad. Now, at the same time, I understand it, because if we had all these patients or doctors going around bad-mouthing each other and that was acceptable, that could also cause a lot of problems. And then maybe that would affect one of the pillars, which is justice. Maybe it would be bad for everybody ultimately if that practice continued. So, you can make a case that it's a good thing to not badmouth your fellow dentists. But if you do see work that's below standard and they're asking this question on the interview, what I would say is I would try to talk to the dentist and just let them know, hey, I told the patient that, this is what I'm seeing. I don't know why. I didn't know where it came from. I had to be honest with the patient to talk about, here's what I'm seeing, but I didn't make any. First of all, when you're talking to the patient, you don't want to make any, want to try to avoid making kind of like a hypothesis about how it happened and what that other dentist did to result in this. You just want to say, here's what I'm seeing. That's all I can say. And then you might talk to the dentist. If you see this as a pattern, I might say to the dentist, I've seen this, especially if it was a colleague or something, I've seen this a number of times. Just want to let you know that I keep seeing treatments that are coming in. So you might think about, shifting this or making a suggestion to help improve that dentist. And maybe they just don't know any better, and there's an aspect of just lack of education or awareness, or they're doing things based on the old standard. Not an easy thing to do, but it's maybe worth a conversation if they're your colleague and you continue to have to kind of clean up and see a number of patients come to you from that dentist who you can see it's causing them pain or causing them a fair amount of suffering. So that'd be probably the way to do it, is to take that approach and make sure never to badmouth, but what you can do to reach across. Now, if it was a colleague not in your clinic, probably not as much that you can do, except just, be honest with the patient about what they're seeing, about here's what I'm seeing, and, I'm not sure how this happened. It's possible this happens every so often. And so, don't badmouth, don't make an assumption that it's a bad dentist. Never say there's a bad dentist there. You should have not gone to him or her, that kind of stuff. Okay, someone's asking, Quentin, what should we say when the interviewer says that you probably will not be admitted to our school this year? How should we react? And this is not an ethical question. It's an interesting question, though. Oh, interesting. I would I would say that's you just don't know where they're coming from with this one. And my sense with this is I like to be really ready for these kind of questions. And when I go into an interview, I actually do imagine kind of terrible interviewers who say jerky things like this. Likely, it's possible that this is a stress tactic. They're trying to cause stress for you. And what I often find, which is funny about stressful sort of attack-like questions about this, is that they can be, you can walk away and let them throw you off track and be like, oh, okay, and you can show that you're upset by them, or you can just be like, oh, really, bring it on. And so my attitude a lot of times with this kind of comes up is, this is an opportunity to show that you're a bigger person than that. Like, this sounds like something that a small person would want to say, try to get you upset, try to make you react. And so I would just show and display and demonstrate that I'm a bigger person than that. I'd be like, it's totally reasonable that you have, of course you're going to make up as a committee, as a selection committee, you guys have to do what's right for you. But I just want to say that whatever you guys decide, I am really honored to be here today, really excited to be here today. And I think that I have a lot to offer your program. So, it's absolutely respect whatever decision you make. But I will say on my behalf, and I say it as humbly as I can. But I think that if you do pass on me, I think you're missing out on a really great candidate, because I feel like I have this, and that to offer. And I would go in and kind of assume that question is sort of like, and we've talked about in other workshops, like, why should we choose you? I would sort of go into that a little bit more and just say, if I could just make a quick case for myself, and I'm not expecting to change your mind. I totally respect your decision either way, and what you're saying right now. But I would like to say that this is what I bring to the table, and I think there's a lot that I have to bring, and I would go into some of the things. And you know what? They take it or they leave it, and they say, well, thanks for telling us that. We appreciate your thoughts, and just letting you know what we think. But you've just shown that you have a good attitude, that you're not someone who takes it personally, and I think that goes a long way. And if it's almost like a bluff. We talked at the beginning. If you guys, for some of you who are here, interviewing can very much be like poker, and especially with these kind of questions where they're stress-based interviews. A stress-based interview is interesting because they will try to make the interviewer uncomfortable on purpose to see how they react, and they do it to everybody. So this to me sounds like, unless this person was just being really honest with you, to be cool with you, it could also be that it was a stress tactic to see how you react to that, and to see how much confidence do you have, right? And so if that's the case, it's sort of like poker. It's like a bluff. They're saying, I have a full deck. What do you have? And now you have to say, oh, you're right. And you lay all your cards down, and oh, you're right. I guess I'll never be good enough, which is sort of you fall into that trap. Or you say, I have a full deck too. Let's play this game. And you kind of go back with that. And you don't be cocky about it. You don't be arrogant. But you want to be humble, honor. I respect what you're saying. Thank you for the honesty. I really appreciate that, actually. But let me just make a quick case for myself. And that's the way I would approach it, being respectful, but also showing that you have confidence in yourself. So great question by Quentin. And if you've ever gotten a question like that, or if you get something similar to that where you can sense that this person is really trying to give you a hard time, really remember there's opportunities in these questions, and if you can use those to turn it around. If you know there's a number of martial arts where the point of them, some specific types of martial arts where the goal is to take their energy and use it back to them, right? So it's kind of taking the energy and letting it flow. There's a flow to it, and that's sort of the idea with some of those questions, with stress questions. So, and then finally, someone asked if we'll be able to see these feeds at a later point of time. Yes, if you're an Interview Mastery member, we will have this up as part of the Interview Mastery course. You're welcome to check this out down the road at any time. And if you're already one, we'll have this up in the course pretty soon. If you're not, then you might consider joining, and we have a lot of amazing other videos that will be helpful for your interview as well. All right, well, thank you guys. I'm running out of time, and I have to jump to another meeting. So I really appreciate everybody's time. As I always say, thanks for the questions. Thank you for participating. I hope this was helpful to you. And if you have any other questions, you're welcome to email me at mail@internationaldentistcentral.com. And maybe there's a specific ethical question that you're like, hey, you said this and that, and I'd like to get your thoughts. I'm happy to usually answer if I have time. I may not answer immediately, but I'll do my best. And we'll look forward to seeing you guys in future workshops. Again, we try to do these relatively often, and we'll always send you an email beforehand. So thanks for taking the time and making it out tonight. And again, I respect all of you who took the time out of your busy schedules to do so. Have a great night, and until next time, thanks.